Afternoon, Mendocino County, and welcome to our Friday update for September 18th. Today, we're joined by our health officer, Dr. Andy Coren, our Department Operations Center Manager, Becky Emery. We'll be giving you guys a COVID update. We'll then take some questions from the media, and we'll try to take some of our viewers' questions. Just leave those questions in the comment section. And with that, I'm going to turn it over to Dr. Coren for today's health update.
Here, I'm learning how to unmute myself. Thank you. Hello, everybody. So this is Friday, September 18th, and I want to go over the statistics first, and there are a few other announcements at the end of this. By the numbers, let me get us onto the stat tracker. And I think here, there we are. Okay, so today you can see in a big red box, and I'll explain what this red box is about in a minute, but our daily positive case average over 7 days ago, is 4.86, which is a very good number. We'll get to that in a minute. The percent positives, it's again over 7 day average 7 days ago, is 3.30. That's also excellent. We're going in the right direction from purple to red to orange, but we are not there yet. The total numbers of patients who have been sick in the county is 822. Hospitalized at this point are 4 patients, and 2 remain in the ICU, actually out of town, in Kentfield and in Davis. There are 49 people in isolation and 116 in quarantine, and there have been 18 deaths now, 1 more soul lost from our community over the past week. This is an elderly woman, and we are mourning her. So there is a new red box on this tracker, and that is because we're now able to track this 7 day average 7 day lag and put that up here. This gives is a better representation of how we're doing, and we're clearly moving in the right direction. This is good, but we have to have 2 weeks of this red box. In other words, 2 week averages in that red box for the state to help us allow us to turn this tier to red. Now, when we're in the red box or in the red circle or in the red tier, we gain the advantage of a lot more industries open, a lot more things that we can do, but we remain in purple, though I just wanted to let people know we are running in the right direction, which is great. This week, unfortunately, we also ran into an outbreak. And let me see if I can unshare here. Oh, I'm sorry. Unshare my screen. Let's go back here. And, okay, I may need some help to unshare. No.
Dr. Coren, you're alive. We can see you.
Oh, you can see me. Oh my goodness, I can't see me. But that's all right. I don't need to see me. I know what I look like. So this week there was an outbreak in a large local retail establishment, Kent Fowler Sales in Ukiah, and that gave us 9 new cases. They have been trying to follow all the guidance, but even with following all the guidance, some cases will become positive. And if they're not caught soon enough, or we don't prevent their spread, it'll become an outbreak. So this is a reminder that the best of compliance contagion is possible. They have been working very closely with us to help to fix this. As soon as it became apparent to them, they closed their business, did a very deep cleaning, and they've invited us in to actually look around and figure out what gaps there were. And they have found some gaps in masking. For example, in the lunch or break rooms, there were some tight spaces that it's kind of difficult to ensure that people are aware of the need to space. And they are working on all of those things. They've done a major training with the management. Everyone who comes in with any kind of fever or symptoms is now being sent home. Both the staff entirely and the clients are required to be masked inside. And so they are really coming along and cleaning up their compliance which they thought was fine, but they're learning some new things that they need to be doing. And that's what we expect, but we want people to look around their businesses and where they're going and make sure things are up to snuff. This is a very expensive thing for this business, and it is also, unfortunately, something that may take us partially back to the purple, where we don't really want to go. So I'm going to finish the part of the COVID update there, and just say that we have been having fire here. Everybody knows, but it is better. There's been some relief in the air quality for sure, and the response to the fire has had some success early, but we want to let people know that the fire is not over. The threat is not over. We're still in a very dry period, actually in the early part of the fire season. So please listen to advisories that come over and be prepared for evacuation if needed. Through all this time of close down, shut down, shelter in place, we appreciate the tremendous stresses to individuals, to families, businesses, and all the other institutions. We're encouraging everyone to talk to each other about those stresses, but also, if needed, there are call-in lines, and we want you to remember the emergency line is 1-855-838-0404, and for a warm line to actually talk to someone, it is 707-472-2311. So please, if you're feeling stressed, reach out to family and friends. And family and friends, please listen to the people who are reaching out. That is one of the best ways to deal with stress and recognize someone who is really in trouble and needs some additional help. I also wanted to take some time to talk about the seasonal flu, which is coming up. It's a seasonal epidemic. And although we tend to get a little complacent about it in some cases and not worry, oh, it's the flu season, we're very concerned about the convergence of the influenza epidemic and the COVID pandemic. Everyone must know by now that COVID can be asymptomatic for the first couple of days people get it, and it can be asymptomatic all the way through the illness. Well, the same is true with influenza. Yet during those asymptomatic periods, people can transmit the illness to someone else who can become very, very sick. So we do want to take this epidemic and pandemic together very seriously. One approach that's important to remember is what they've coined, and I've just learned, is presenteeism. Don't feel like you have to go to work if you're sick. If you are sick, stay home. It will not only save you and give you a little bit of time to rest up and get better, but it will save your coworkers and people you come in contact with a tremendous amount of illness. The illness, influenza, is very similar as it appears to COVID, but together the threat of transmission and the severity of the disease is potentially, and we expect to be much more this year. Although because we're masking, we're hoping that that will cut down some of the transmission of influenza. The best prevention for influenza is the influenza vaccine. It is, questioned what the efficacy is from year to year, but it is especially effective among healthcare workers. Healthcare workers have a high transmission both from healthcare worker to healthcare worker, and the healthcare workers are an important vector and important as an example in our community. So we've looked at that, and the research shows that when 100% of the healthcare workers get a flu vaccine, the decrease in hospital-acquired influenza in acute care hospitals goes down by 43%, and in nursing homes it goes down by 69%. So it's very effective in that way. In the past, there have been orders among healthcare workers and institutions to either get a vaccine or wear a mask. And now many people are wearing masks and they're saying, well, maybe I can avoid the vaccine this year. I want people to understand we want you to vaccinate against the flu, wear the mask for both the flu and COVID. The mask is not an adequate protection. The American Nursing Association, most physician organizations, and all the physician organizations that are involved in prevention and infectious disease recommend mandatory vaccines among healthcare workers. So we're continuing to encourage everyone who's over 6 months to get vaccinated against the flu. And now there's a major focus on healthcare workers in hospitals, clinics, private offices, including dentists, podiatrists, physical and psychological therapists' office, chiropractors, anyone who has contact with patients who may have a little bit more vulnerability. We want you to protect yourselves and them against the influenza. So get your flu vaccines at your clinics, pharmacies, doctors' offices, and hopefully by November 1st, if possible. And I'll close at this point and ask if there are any questions.
Thank you, Dr. Coren. We're going to start with 2 questions submitted by Matt Lefevre with KMUD. Let me start with the first one. With fire personnel from all over the state and the county coming to Mendocino County to help with the fires, what can you tell residents about the collaboration between public health and fire management agencies to mitigate the spread of COVID amongst firefighters? Does the presence of out of the area and out of state firefighters increase the risk of COVID cases in the county?
Well, that's a great question, and I'm glad to answer it. We do have people coming from all over the state, and in fact, from many states, and I've even heard from some places around the world. And yes, it potentially could increase the risk of COVID in our community. But last week, I actually went up to their encampment at the fairgrounds here and watched and learned what their internal precautions are, and was incredibly impressed. They have 2 whole units out of the 6 that exist in California that are focused on the fire to our east. And every one of those firefighters has to walk in through a screening area before they come into the encampment every single time, where their temperature is taken, and they have to wash their hands. They have to be masked, and they are in their own cohorts, small groups, where they eat together, sleep together, and they fight fires together. If there is anyone who has a fever or anything else, they're getting the same sequestration and care as anybody would if they were civilian. However, as they are emergency workers, if they're doing well, many of them will continue to be working in their jobs. Another associated question that I had when I visited was, yes, we have some people from the prisons helping them, and they are equally required to be tested and walk through the same screening areas, and they are also cohorted, so they're containing their COVID exposure to each other and to the community as much as I think is possible. When they revealed to me from their handbook, which they publish morning with all of the different, they publish it every morning with all of the different priorities that they have. Number 2 is COVID prevention and taking care of their forces. So I was very impressed, and I think the whole community should be.
The next question we have from KMUD is, last week, Placer County's Board of Supervisors voted to end COVID-19 restrictions and the public health officer resigned. How does the Board of Supervisors govern the action of Mendocino County's public health? What can you tell the public about the cooperation and collaboration between Mendocino County's Board of Supervisors and public health? Before I pass it over to Andy, just a little bit of detail. The Board of Supervisors does appoint the health officer, and the health officer is the one responsible for the health orders and issues the health orders. And I'll turn it over to Andy and Becky if you have anything you'd like to add in terms of the close working relationship with the health officer and the board.
Well, I will say that the other step is that from the point of view of public health, it's very important for us to understand what the community is going through and their perceptions. And the board are elected representatives, and I very much, and I think the Department of Public Health very much respects their input and their perceptions and so on. In Placer County, they had a situation where they believed that their orders were too restrictive, and they really wanted what we're calling going rogue, even from the state orders, and they put at risk a lot of the state money, grant money that we get in various counties, And they're able to do that from their finances. They're able to do that. But there was a dissociation between what the board did and what the health officer felt was right. And so in that case, the health officer quit. I don't think we're at that situation here. I do think we have gotten a lot of feedback through the board and from the community that our health orders may be more strict or more confusing than the state orders are. And that has come directly to us in public health, and it has also come through supervisors. I think that we want to be in lockstep on this. We are considering that in the next week, a significant modification of our health orders, and that is something that we're working on. But I don't see us, quote unquote, going rogue because we can't afford to do it. The state does control it. But the original orders were a bit confusing to wade through, and there were some differences between us. And we came out with orders in many cases before the state because the state was lagging, maybe because of their bureaucracy or whatever. It was before my time. But the health officer that we had before then was very proactive and was able to keep our numbers down by issuing a lot of orders that actually were picked up by the state. So I think that, the short answer to your question, I'm running on and on, is I think that the health department, myself, and the Board of Supervisors really want to be together on this, and we want to be together with our community on this. And we're seeing a change in the COVID epidemic. I think we're getting more on top of it. People have taken those orders from the state and the local orders, and they're learning them. They're implementing them. The example that I was just talking about, the outbreak this past week, is an example where they, on their own, figured out this was an outbreak, shut it down, started doing the cleanup, asked us to come in and help them. That's the kind of cooperation we want to have as we go forward. I hope that answers your question.
Thank you, Dr. Coren. We'll move over to our next member of the press. And to our viewers, if you have questions, you can leave them in the comment and we'll try to get to them after we finish up the Q&A with the press. So moving to Sarah Wright with KZYX. Sarah?
Hello, thanks for doing this and for taking our questions, Dr. Coren. You mentioned screenings a few minutes ago, and I've been seeing screenings at various places, and they usually consist of taking a temperature and asking a few questions. And I'm wondering if those are really useful, since people who are completely asymptomatic can have the disease and spread it.
It's useful because some people will come with minimal or early symptoms, and then they may be running a little bit of a fever that they're not even always aware of, and we can nip it in the bud. We can tell people, take a few days off, get yourself tested, and if you need to be quarantined, you're quarantined. So it is a very excellent way to do it. It's not like screening everybody every day with a nasal swab, but we can't do that. So this is a way to try and get ahead of an infection that is easily transmitted and can be transmitted before people are themselves aware of the problem.
And just a quick follow-up to that, have there been a number of cases that have been discovered through the screenings? Or is it even possible to know that?
We know of people who have been sent home from work because they had a fever. Absolutely. And people who have symptoms are being sent home. And then they're told to get their screening tests at, for example, either the emergency room, their doctor's offices, and some are just even though we don't appreciate it, they walk into OptumServe and get it there. OptumServe personnel are now accepting some people who are symptomatic. We really want that to be a screening station.
Okay. And I have a question about an outbreak in Sonoma County. We just learned this week that 13 child care centers were affected by the disease, and something like 26 kids got it. And I'm wondering if that is giving health officers in the region pause, or if there's some thinking about tightening up policies about child care, since that's a huge number of little kids getting the disease.
Sarah, I heard a little bit about it. I can't tell you I've heard an awful lot about it. It is something that is concerning to me and to others because although the contagion among children has been felt to be much less, As more childcare schools and so on open up, there were also outbreaks among the college students, which is not unpredictable because they live in dormitories. But we're really looking at this part of the population, especially as they come together in schools and daycare centers and so on. So unfortunately, I can't give you an answer except that yes, it raises my eyebrows. I want to look into it more. I want to see what they're doing in Sonoma County. They have an excellent health department, and we are partners with them. So it's something that I will be looking to learn about from the calls that we have regularly with them.
Right. And so that's something that you'll keep in mind as we move into the next tiers and consider sending kids back to school or childcare.
Absolutely.
Okay, thanks a lot.
Thank you, Sarah. Moving over to Susan with the Independent Coast Observer. Susan, and you're currently muted.
Thank you. I wanted to ask what kind of details you can share about the 18th COVID death that we had recently.
Online, I don't really want to share that much because of the privacy that we afford all of our patients and people in the community, individuals. It was a Hispanic woman, an elderly Hispanic woman, and she was seen in our healthcare facilities and then released to home, and that is where she passed away.
Okay, thank you. And the other question I had, let me see if I can find it here. The outbreak in the in Ukiah. My computer cut out for a second there, and I couldn't quite get the name. Is it called Dollar Stores?
No, it was Ken Fowler Auto.
Oh, sorry. Thank
and
you.
he has given permission for us to share that. He has been very open and very proactive in working through this problem.
Okay, thanks so much.
Sure.
Thank you, Susan. Moving over to Adrian Bowman with the Mendocino Voice.
Hey, Dr. Sarah. My computer actually also cut out right when you said Ken Fowler Auto. And so I'm wondering if you could just quickly clarify how many cases were associated with that.
My understanding was that it was 9 that it was officially found. Becky, was there another? Can you inform us more about the details of that one?
Hi, Dr. Coren. So yes, we've had 9 cases that have tested positive, and they have all been very closely together in those test dates rather than some of our prior outbreaks where we've had them spread out over several weeks. So in some cases, that's very fortunate for us. And as I shared, the 9 cases have all been employees, and so we are working very closely with them. We had outbreak testing provided this morning, as Dr. Coren shared, and also a site visit with our environmental health team, and they will be returning for a second site visit and providing additional supports.
Do you think it's possible that more cases might come to light associated with this close contacts of these employees? That it's happened recently enough, there's a little latency there?
It's possible. That's why we do the testing.
Okay.
And if we find positives, then they will be in isolation and their contacts will be traced, and we'll ask them to be in quarantine. But yeah, okay. That's what our worry is. It doesn't just stop with identifying a few people. But it is one of the reasons why we worry about even just a few people, because the numbers can multiply after that. Hopefully this will not happen, but it could.
Thanks for that clarification. Sorry about my computer glitch there. Sorry if that was redundant and everybody else already heard that data. So my first question is, if you've got any more information on the large gathering that you mentioned last week, I spoke with Chief Martyr, and he said he had not heard anything. He was off that particular day, but then he spoke with his staff, and he apparently hadn't heard anything about large. So you mentioned a 2,000 person gathering over the Labor Day weekend, and I have not gotten
I had heard about it, and I think I mixed up Fort Bragg and Bodega Bay, is what I think. I don't want to send you up wild goose chase, but I heard there was something like a rock concert out there. That's what and again, I haven't traced that down. I think if Mr. Martyr said we didn't have it out in our county, I'm totally happy.
Okay, thanks for that. So my second question is kind of more long-term and big picture here. I'm wondering, and I'm not sure how to even what kind of response I'm looking for here, but it seems like there's we're going to just be yo-yoing between more restriction and less restriction. That the second we open up, the second that we loosen restrictions, there's new outbreaks potentially tied with the winter. Then we'll close restrictions down, and the curve gets flat, and we open back up, and there's more outbreaks. So I'm wondering first of all, if that's accurate, and second of all, if we are going to sort of, as a society, yo-yo between more and less restriction, how long does that yo-yoing go on? Or is there some mix of restrictions that we can dial in and have a steady level that we can sort of build procedures and infrastructure around?
That's a great question. I think we had the yo-yo bounce in the spring and summer, and every time we have an experience with this pandemic, we learn something. So what I would say, though, is that we think we're dialing in the right kinds of restrictions now, but not just restrictions. Part of this is that our communities, the businesses, but also individuals, are really learning a lot from what we initially imposed, and now we sort of expect. So I was on phone call today with enforcement, because we are looking at our current orders, and the numbers of calls and questions and complaints has fallen down quite a bit. That means our community is learning. They have less questions. People are less upset at other neighbors who may be doing things. And this is a behavior change that's becoming built in. Now, it may be that we want to relax some of those, and we certainly do. As we turn red, we want to have people eat indoors. We want to have various different things that will be in that tier. But the reason for the tier structure is progressive opening up, and at each level that we open, we'll learn those things. Also, at the same time, the state is also looking at not bouncing us back and forth every 2 or 3 weeks, but perhaps longer cycling, because you could have an outbreak like we had this week, and you're in red, and all of a sudden you're bounced back to purple. Well, do you close everybody down, or is there some intermediate way to deal with that? And we don't have the answer to that yet. Remember, we're all in this together. We're all learning as we can. I have a perception. You have a perception. Scientists in Washington and in California, they all have perceptions, but they're trying to understand what's going on with evidence that's accumulating to make our lives more livable, less crazy. And I think that's what you're describing, is a little craziness in the future, and we don't want that.
Yeah, I think there's a lot of, people and businesses and schools and stuff can sort of learn to adapt if they know that the rules are going to be there for long term. But if the rules are going to be bouncing around every couple of weeks, then you build an outside tent, you put a bunch of money into it, and then we can eat indoors, and you go back indoors, you tear down the tent, oops, we have to go back outside, buy heaters for the winter, that kind of thing. So you think that that's going to happen less, and that the state is also looking at ways to elongate those cycles if they do happen?
Well, what I'm saying is that the tiered program to reopen is so that at every tier, our community, all of us, learn what we have to do to keep safe from these germs. And if we learn well and we implement them well, we're thinking that will gradually get better, and we won't need to be closed down as much. We didn't know very much at all when this hit. Then we closed way down, and some places did a great job closing down, and the statistics looked like they were getting better, and so it was opened up with no tears. You could now go back to doing this and that. That's not what this present plan is putting forward. It's a much more thoughtful plan, and they're still working on it. It's not that this is going to be the end of it. We're refining our approach to this pandemic. But
All right,
I appreciate your insight, and that is what has come up in the state calls that I've been on.
thank you very much, Doctor.
Thank you, Adrian. Before we move over to some of the questions in the comments, Dr. Coren, can you touch a little bit on opt-and-serve, just where we are in terms of turnaround time, and why the surveillance is really important to help us get to that next tier?
Thank you. I skipped over that in my presentation. Opt-and-serve is a contract that we have to do surveillance or screening testing. We have only so many tests that we contract for, but we need to do, I think it's 85% to maintain that contract. And so recently there have been several days where the numbers have dried up. We didn't have as many people showing up. In the last few days, they picked up again. But here's the value of the screening. One, if you have it, you're not symptomatic. And if you have it, you're not symptomatic, you're on quarantine, and you won't give it to other people. So the surveillance testing and screening testing is an extremely important part. It's a proactive part, not just for us to keep statistics, but for us to wrap our heads and our hands around this infection. So it's very important. And we want to recommend that people go down and get their testing at opt-and-serve or at their clinics. They can get screening also. And we do that through another source, which is UCSF. These are both on contract, and they don't last forever. We're trying to renegotiate an extension of them. So please take advantage of it. One of the things that we are trying to do in the next week or so is change the schedule of opt-and-serve so it will be open on Monday. It hasn't happened yet. On Sunday. It hasn't happened yet. So I don't want to promise that, but hopefully in the next week, it'll be open on Sundays through Thursdays. And that will attract in a lot more people from the community who use Sundays to go shopping, from the coast, who go to church on Sundays, for whom it's really much more of a day off. They're not fitting it around. It's a family day. And so we're trying to expand that. But this week, it's, what is it? It's Tuesday. No, yes. Tuesday? Tuesday through Saturday. Okay, good. Just checking. Tuesday through Saturday at this point.
And just to add, we are seeing a really fast turnaround in that 48 to 72 hour period. I can personally attest. I went and got tested last Saturday, and by Tuesday morning, I had my results. So they're coming in really quick. So we've been seeing that backlog issue resolved. So you shouldn't have a problem.
Let me add another thing. The technologies have advanced so that we're now doing mid-turbinate. It only goes into the nose about that far. It doesn't reach down to your never wears. Okay, it doesn't cause you to choke, and some people it doesn't, but for some people it's really uncomfortable the way we initially had to do it to get a reasonable sample. But as the technology advances, they've been able to make it as effective with less penetration. They are doing work on developing saliva tests, and they're working on a lot of different things, but at this point, in opt-and-serve and the other tests, it can be what we call mid-turbinate or a nasal swab rather than a nasopharyngeal swab.
Speaking of testing, we have a question from one of our viewers. Will rapid testing be available to the public anytime soon?
Yeah, I think it will be. I know that there's a number of things in development. One of the issues is how do you interpret them? And we have been learning how to interpret rapid antigen tests because there are differences in how sensitive they are and how specific they are. But for the healthy population, there should be some more rapid turnaround tests and even self-administered rapid tests. That's what we're hoping.
We have another question from the viewers. Would you recommend getting the flu shot?
Yes, 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 yes. Everyone should get a flu shot. It will be terrible to have COVID and the flu in the community and affecting people. If you sneeze from flu, and if you have an asymptomatic case of COVID, you're going to give it to somebody, you're going to give the COVID and the flu to somebody else. So masking will help, but the best way that we have to prevent the flu is the vaccination. Remember, right now, what's being held out as the big savior of our society is a vaccination against COVID. Well, why is that? Because we've been able to eliminate certain diseases with vaccinations. You don't see much smallpox around. You see pretty rare cases of chicken pox, and we can go on and on, polio and so on and so forth. It works. There has been some concern about the influenza test being less variable in some years as low as 40% protection. They've added more viruses into each shot. So now instead of 3 different strains of influenza, many of them have 4 different strains. They've added a higher dose for some people who may be more vulnerable. And what I was saying before is we really want to focus on anyone who gives care to people who are vulnerable, in particular, all of the healthcare workers. We really encourage getting the flu vaccine. Now, some people have said, well, we're wearing masks for COVID now. Everybody's wearing a mask and we're not going to pass it around. In the past, in institutions, they have said you must have a flu vaccine or wear a mask. And so some people are saying, well, I'll wear my mask and just forget the flu shot this year. Not good enough. Get your flu vaccine and wear a mask.
We have another question. We had 2 days of 0 new cases this week. Why? And would we still be showing a red tier on our tracker that we're trending in the red if those test days would have been accurate, and should we have faith in the testing numbers?
There's a couple of things I would say. We have some red in the tracker because a week ago, we had 7 days where we averaged less than 7. If we had some days of 0 in the following week, even if we had some days with a little bit higher numbers, then it would average out and we'd have another week of red. And then we could move our county to the red tier and enjoy some of the things we'd like to do indoors. I don't know if I answered the question as fully as it was asked. So someone help me. Is that pretty good? Okay, good.
We have another viewer wanting to know, wanting to see more inclusion of the Latin community and wants to know if there's additional software or things we can be doing to help communicate. I just want to quickly say we will be back here at 4 p.m. for the Spanish update, and we started that a few weeks ago. We're also looking into some other different options for live translation of our updates. And every Friday, we'll be posting highlights and a recap of our update in both English and Spanish. So look for that on the county's Facebook page or Public Health's Facebook page, and join us here at 4 p.m. But we are taking it seriously and working with the Latinx community to have more resources available.
Yeah. We've been working as a county with the Latinx community leaders for many months, and more translation services have been obtained. We've put out a number of Spanish posters and some Spanish videos. That's being done in a number of counties. One of the ways that we're trying to involve the Latinx community is by reaching out. And one of the things that we've found is that, hey, the Latinx community works 6 days a week, but Sunday is church day. And if you could open the screening on Sunday, you might get a lot more people from that community. And that's one of the motivating factors one of the big motivating factors to having us move OptumServe to being open on Sunday. Another thing that we're doing is that we do have some grant money that we want to be partnering with our clinics all over the county. so that they can do more outreach to the community businesses, vineyards, and so on and so forth, where they are, which will both get to the community better, but also get some community members into the clinics to identify the clinics as their own primary care of service. So long term, we want to get more in the Hispanic community tied into the medical community. And finally, we do have some money and we're looking for more to be able to hire people into the health department and into supervisory positions and organizing positions from the healthcare worker to supervisory positions in our department, so that we really become a bicultural as well as bilingual service for all the members in our county.
Thank you, Dr. Coren. I have another question related to flu shots. Is public health going to have a drive-up option for flu shots this year?
That is being debated, frankly. We have always, and there is a lot of energy to be put into it. The question is, how many people do we really serve that couldn't be served by another way to do this, which is more emphasis on the clinics? And by doing it, hold on a second here, by doing it ourselves, are we interrupting that connection between people and their providers? So this is an issue, and I would love to have people feedback to say, no, we really want to have it at the county health department, or we'd rather go to let's say Mendocino Community Health Clinic up the road, or we get ours at Anderson Valley and we bring more people if they were there. It's an area that we want to look at, but we really want to make it where people can get their flu shots and where they can get information and where they get hopefully connected to ongoing medical care.
And it looks like we have one more question in our queue. I'm wanting to know if the poor air quality and some of the evacuations affected the amount of people coming out to get tested for COVID.
I don't think I can answer that. We have, when it was really horrible here, I think we had a drop off in people going to OptumServe. And in the last few days that it's cleared up, we've had many more people. So that's a good thing.
Yes, we've definitely had more people, and we've had a lot of people utilizing the walk-up feature at Optum. Of course, you can schedule an appointment or you can go ahead and walk in. So that concludes our Friday update for September 18th. We will be changing our schedule moving forward. So we'll be back here on the first and third Friday of the month. So our next Friday update will be on October 2nd, and then on October 16th. We'll be posting reminders about when our updates will be in both English and Spanish leading up to those events. So we hope you guys have a wonderful weekend, and we'll see you back here on October 2nd. Thanks for joining us.
Thank you.